Yeah, this is for new mothers. Immediately your child is delivered, whether you are the father or the mother or the guardian or you are assisting, before you go home, before you take your child home, there are certain things you are supposed to check in that child to be sure that all is well. Because I found out that some parents end up going home after the child has been born and only to find out that there is no anus. The child does not have any anal opening. There is no anus. The child does not have any opening in the anus for stool to pass through. So these are certain parts of the body you should check when your child is born. First, check the eyes. Check the eyes. Are they two eyes? This thing may sound funny, but you'll be shocked that some children are born with an eye, just one eye, and the other eye is not functional. Or two eyes and the other eye is not functional. Check the nose to be sure that the opening, the nasal opening, the nose is open, the hole in the nose are open. Check the mouth. Check the mouth. Sometimes some children are born with as they are born, they already have teeth, and they call it natal teeth. Check the mouth. Then another thing you need to check in the mouth is to check whether they have cleft lip. Sometimes you will notice that the lip is divided. So they have hole in the lips. They call it cleft lip. Another thing you need to check in this child, a newborn child, is the tongue. Sometimes you will notice that there are some children that when they are born, the tongue is tied to the floor of the mouth. So they will not be able to raise their tongue, and they will not be able to cry well. And if nothing is done about it, later in life, they will not be able to speak, to talk clearly, audibly. This will affect their speech later. After that, we are still on the head. Check the ears. Are the ears normal size or they are smaller than how they are supposed to be? Check whether the opening in the ear. Check whether the opening in the ear are intact. Are the ears open? Now, come to the chest. Look at the chest. Are there any problem with the chest? Look at the hand. Look at the way the child is moving the hand. Is one of the hand weak? Is one of the hand more active than the other? Those are the things you should check. Also check for, sorry, I know I jumped this. Check for the eye for jaundice. Some children are born, some babies are born with jaundice. Check this eye. Check the eye for jaundice. If there's jaundice, alert your doctor. If you notice that the eyes are yellow, let your doctors know. Another thing you need to check is the tummy. Check the tummy. Is the tummy bigger, or is this big? Is it distended? Is it folded on itself? Check the tummy. Then another thing you need to check, check the anus. Is there a hole in the anus? Or is the anus higher up? Is there a hole in the anus for this child to... So there's what they call imperforate anus. There's no hole at all in the anus. And if nothing is done about it, the child will be sucking quite all right. If the child is sucking, the child will not have any where to pass to from. The child will not have where to pass to from. And when the child does not have where to pass to from, the child will start vomiting. The stomach will be distended. The child will be crying. No, the child cannot tell you they are in pain. The child will be crying uncontrollably or inconsolably. That's another thing. Check the anus. If it's a girl, check the private parts. Check for the male. Check the penis. Check the penis. Check whether the hole in the penis, in the manhood, is at the tip of the penis or it is somewhere else. Check the scrotum. Check whether the testes are down. Some children are born with undescended testes. Check whether the testes are down, the two testes, whether they are within the scrotum or they are higher up. These are the things you should check. It's not just to have a child, to give birth to a child. There are some things you must check to be sure everything is in order. Yes, also check the legs. Check the fingers. Some children are born with more than 5 fingers. You will see them, they have 6. If you check and there is any problem, let your doctor know. Check. Also, some children are born with no hands. Yes, all these are called congenital abnormalities. Also check the legs. Check the feet. When you are checking the feet, check for the number of toes. Are they 5 or more than 5 or less than 5? Now, higher, come up now. Some children, especially the girl child, they are born with nipple, extra nipples, extra breast. Check for all these things. I don't know. I know that there are some things I have not mentioned. But if you do all these things, you will notice that if there's any abnormality, you will pick it very early and you let your doctor know. You and your child will live better for it. It will improve the quality of life of your child. Don't just go now. Before I forget, check the back of your child, whether there is hole or there is hair at this where spinal cord is. Check the back of your child. For children with spinal bifida, you will notice that there is a hole in the back that is draining something that looks like water. They call it spinal bifida. It's a serious birth defect. Check the back. It's very important. Your doctors will check all this. Your nurses will also check all this, but also check to confirm. It's your child. You should be concerned about the welfare of your child. Check the feet. Check. In fact, check everything. Please follow this page, like our page, and continue to support us. Bye bye.